The patient assessment is an integral part of delivering quality medical care. It involves gathering data, interpreting the information, and planning treatment or further action. Healthcare professionals can use the tool to assess a patient's overall health and physical condition, identify potential risk factors, evaluate an individual's current symptoms, and examine their pre-existing medical history. Our patient assessment at Carepatron is structured like this. Firstly, we have patient information where you can fill out the details of your patient. After, we have social habits, which asks about things like drugs and alcohol usage, cultural religious beliefs that may affect care, how they prefer to learn, and whether they have any barriers to their learning. Next, the form has a hospitalization, surgery, major illness section, where you can write your client's past health issues. There is then a gynecologic and obstetric history section, medication section, and nutritional data section. The final table asks about the patient's personal and family medical history. In our example, we can see that the patient has a peanut butter allergy. Assessing a patient's overall health can help you identify potential health risks and intervene early if necessary. With a patient assessment, you can track a patient's progress over time. This allows you to monitor changes in the patient's condition and make necessary adjustments to their treatment plan. Having a pre-made patient assessment template can be extremely helpful for healthcare providers. To find our patient assessment, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.